Hello, everyone. Welcome to another episode of Retina Roundup. I'm Dr. Yashasvi, Fellow, Vitrio Retina and Ocular Oncology, and I will be taking you through this month's top articles. The first article compares the effect of applying 360-degree endo laser encerclage versus local retinopexy on the redetachment rate in patients who underwent pars plana vitrectomy for primary rhegmatogenous retinal detachment. A total of 973 eyes were included, with endolaser encerclage being performed in 311 and localized retinopexy in 662 cases. With an overall redetachment rate of 7%, the rate was significantly lower in the endolaser cerclage group, even when controlling the confounding factors. Further, subgroup analysis revealed a higher risk of redetachment in patients with the primary proliferative vitreoretinopathy, macula off situation, and silicon oil tamponade. Combined phacoemulsification did not increase the redetachment rate but rather lowered it. In addition, no difference was observed in the occurrence of secondary proliferative vitreoretinopathy redetachment between the endolaser cerclage and localized retinoprexy groups. Hence, the study suggested that using 360-degree laser retinopexy during retinal detachment repair improves surgical outcomes and should be considered a preferred treatment option, especially in cases with severe retinal detachment. The next article we have investigates the association between pre-retinal hyperreflective dots, PHDs, with the occurrence of epiretinal membrane after pars plana vitrectomy for rhegmatogenous retinal detachment. A total of 894 patients who underwent vitrectomy for RRD 417 were included in the analysis. Univariate analysis showed significant associations between ERM occurrence and macula of RRD, number of retinal tears, use of cryopexy, C2F6 tamponade, and presence of PHDs on optical coherence tomography. On multivariate analysis, presence of PHD and use of cryopexy were significant predictors of ERM. Kaplan-Meier analysis indicated that cumulative probability of developing an ERM at 6 months was 4% in the patients without PHD, but 26% in the patients with PHDs. The study hence concluded that pre-retinal hyperreflective dots are associated with the occurrence of ERM after vitrectomy for RRD. Moving on, the next article aims at identifying optical coherence tomography and OCT angiography biomarkers associated with persistent retinal fluid in treatment-naive neovascular age-related macular degeneration following 3 loading doses of anti-VEGF therapy. In this retrospective study, 60 treatment-naive typical neovascular AMD patients received 3 monthly intravitreal bevacizumab injections. 4 weeks after the third injection, patients were categorized as responders when no fluid was seen and as suboptimal responders if fluid persisted. Baseline OCT and OCTA parameters were assessed, including central macular thickness, subfoveal choroidal thickness, pigment epithelial detachment height, hyperreflective foci, subretinal hyperreflective material, and macular neovascularization morphology. Ocular features were analyzed for loop morphology, branching vessels, peripheral arcades, C-fan pattern, and hypointense halo. Vessel density was quantified on the superficial capillary plexus, deep capillary plexus, and choriocapillaries. No significant differences were found between groups in baseline OCT parameters. Vessel density also did not differ between groups. However, OCTA revealed that loop morphology, peripheral arcade, and branching vessels were more frequent in suboptimal responders. On multivariate regression, only loop morphology remained a significant independent predictor of persistent fluid. Hence, the conclusion was loop-shaped neovascular morphology on baseline OCTA independently predicted poor anatomical response to anti-VEGF therapy. Identifying such features may support early risk stratification and guide personalized treatment strategies. Going further, aim of the next article we have is to determine the characteristics and treatment of the extensive subretinal fibrosis in the eyes with rhegmatogenous retinal detachment but without tractional retinal detachment in patients with familial exudative vitreoretinopathy. 10 eyes of 9 men and 1 woman with ESF, that is extensive subretinal fibrosis, in patients with RRD FEVR were studied. The characteristics, surgical procedures, and the outcomes after the removal of ESF were determined. The ESF was excised by either stripping the ESF from the small retinotomies or by en bloc excision through a greater than 180-degree retinotomy or retinectomy at the ora serrata. All cases had a unilateral macula of retinal detachment with a total retinal detachment in 4 eyes and detachment over 2 quadrants in 6 eyes. The first case underwent ESF stripping through small retinotomies that required 7 additional surgeries with a final visual acuity of hand motion. The subsequent 9 cases underwent en bloc excision, resulting in a retinal detachment with silicon oil tamponade. The silicon oil was removed without a recurrence of the RD during median follow-up periods of 7 years. The median final visual acuity was 20 by 66 with a range of 20 by 17 to 20 by 500. The inference of the study was that ESF can be found in FEVR eyes with a slowly progressive RRD. En bloc excision of ESF is an effective and safe procedure to reattach the retina and does improve the visual acuity. The next article reports clinical presentation, management, complications, and outcomes after retinal injuries caused by intravitreal injections. Retrospective case series of 12 eyes presenting with visual deterioration due to vitreoretinal complications secondary to trauma caused by intravitreal injections. 12 cases of direct retinal trauma by the needle tip of the intravitreal injection were observed. All retinal injuries were located in the temporal mid-periphery, usually near the inferior arcade. Of the 12 patients, 4 eyes developed a retinal detachment with all with proliferative vitreoretinopathy. 6 had vitreous hemorrhage. 2 eyes presented with a focal chorioretinal atrophic lesion. Patients either underwent surgical procedure or were closely monitored after the injury. The surgical intervention was successful in terms of anatomical outcomes in all cases. 10 eyes had a final visual acuity similar to the baseline, while 2 eyes experienced visual deterioration during a follow-up of at least 6 months. Hence, it can be concluded that direct retinal injury with the intravitreal needle is very rare but possibly underreported adverse event. Early detection of these complications, especially if associated with retinal detachment, is important for timely and appropriate management to avoid permanent loss of vision. Coming to the last article, aim of this study was to identify the predictive factors for spontaneous internal limiting membrane peeling after idiopathic unilateral epiretinal membrane removal and to compare outcomes between patients with and without spontaneous ILM peeling. Patients with symptomatic idiopathic ERM were recruited from 5 ophthalmology departments. Vitrectomy and ERM dissection were performed. When the ILM spontaneously peeled off over an area of at least greater than 2 optic disc diameters around the fovea, patients were not randomized and were included in the spontaneous ILM peeling group. Otherwise, patients were randomized intraoperatively to either the no ILM peeling group, NPG, or the active ILM peeling group, or APG. Microperimetry, best corrected visual acuity measurements, and OCT findings were assessed at month 1, 6, and 12. The primary outcome was the difference in microscotoma number between baseline and M6. Out of 213 patients, 101 experienced spontaneous ILM peeling and 100 were randomized. In the spontaneous peeling group, 99 patients were included in the baseline characteristic analysis and 75 patients were included in the follow-up characteristic analysis. Baseline characteristic was similar between all groups. The difference in microscotoma number between baseline and month 6 was not statistically significant between groups. So the conclusion of the study was the difference in microscotoma number between baseline and month 6 was not statistically significant between groups. Spontaneous ILM peeling was common and associated with a better clinical outcome. No predictive factors were identified. That's all for this month. See you all in the next episode with another set of interesting articles. Thank you.